Thanks the organizers to see for organizing this nice session. So 2025, Dr. Natarajan already has put the pretext. It's the AI which is governing the world open media. So these slides I prepared by AI. So I didn't use my thing. I had put a prompts. I had made the summary what I want, my flow of thoughts, and actually it even created. This is freely available. It also created avatar. It gave volume, speak over. I didn't use it. So we are in this era today that we can do. So the whole slides are prepared on gamma. So teleophthalmology in 25, the technology reach and the future directions. So definitely not to repeat, teleophthalmology is important because it addresses the global vision impairment. We have more than a billion people affected with visual impairment. Geographic disparities are there. And there are scalable eye care delivery models which have been demonstrated. And actually COVID-19 accelerated the adoption. Never thought of having these Zoom meetings, teleconsultations that really accelerated after COVID. So if you just look at evolution of teleophthalmology, 2000s, I think I still remember Dr. Badrinath being one of the founder member of TSI, the Telemedicine Society of India, where we had those big satellite, big vans and the satellite connectivity given by ISRO. We had store and forward. So you used to take the images, take the data, store it, then send at the end of the day, and people used to diagnose. 2010 started the real-time teleconsultations. 2020 we started seeing many of these AI triage and portable devices. We had the home monitoring device, the home OCT, the nodal OCT, which was again devised by in Egypt, in Israel, and people started using these even in retinal care. And in 2025, the more thirst in teleophthalmology is going towards these home-based monitoring devices. Definitely portable cameras are one of the things which are shaping the future, these technologies. The AI interpretation, we have beautifully seen by Dr. Natarajan's talk how AI can diagnose various stages of retinopathy. The data storage, which used to be a big problem at some time, today we have good cloud sharing platforms and 5G connectivity so that there's a very low latency as far as consultations are concerned. Coming to home-based care, there are a lot of these smartphone-based apps. Dr. Natarajan was mentioning about Smart India study where we had used the PEAK tool to measure ETDRS visual acuity in the field. Very well validated device. So we could never have thought that we'll take a logmar acuity in the field, but that's now reality. We are able to do that. I told you the nodal device, the home OCT, it's again which is picking up and people. So it's only a couple of years we'll see patients coming and saying, my fluid is again come, give injection. So I think those things is something which we'll see soon. That's where the teleophthalmology is all moving. There are many global success stories. I would say in India, it is the diabetic retinopathy screening, which has really picked up. Happy to share that the AI integration into diabetic retinopathy screening is not only there in AIOS VRSI guidelines, but even for the physician guidelines, the RSSDI guideline. It talks about all the available AI platforms, the portable cameras, and how you can use it. I think a lot of effort has been done in DR screening. Singapore has been leading in various AI platforms. They have integrated it into their healthcare system. They were the first to form the guidelines of using AI. UK, again, people have used in community screening a lot of these AI platforms. And in US, the Veteran Affairs, there are a couple of now work which people are using for reaching out to them and validating many of these AI platforms. However, there are a lot of challenges which we face today, the data privacy, the consent protocol, whether it's an inbuilt consent when you do a consultation itself, you get a consent. Image quality is always a big barrier. Even for DR screening, we know if we take a non-mydriatic image because of our cataract, which we develop in a little early age, nearly 30% of our images are non-gradable and they become referable, so that becomes a problem. Just 2 slides more. And definitely training of paramedical staff is a problem. So the road ahead are these AI platforms, which are decision support systems, mainly based on LLMs, the cross speciality, not only ophthalmology, but having a holistic telemedicine program, and definitely national policies. If we can integrate the insurance integration into these, some work in the field of cardiology has already happened, but in ophthalmology, I think this will go a long way. So to conclude, teleophthalmology today is not just about distant care, it's about equitable care, and definitely future lies in scalability, and collaborative development is something which is very essential to do that. Thank you very much.
Sir, one thing I would like to add, like you said, there is homemade OCT. There are certain apps also available. Like
Absolutely.
they are useful for the patients, like for exudative AMD, so they can just observe their findings. They are old
Yes,
patients; they cannot go to clinic
correct.
on the daily basis, so they can just feel they have decrease in the vision and they need injections. So only then they go to the doctors.
I think
Yes,
all these tools
yes,
will become so.
yeah,
That's why I'm telling 2025, these home-based
yes.
monitoring systems are gradually
Hmm.
having more traction.
Yes, would be very useful.
So thanks, Dr. Rajiv Raman, for your excellent talk on teleophthalmology, and you are in fact working a lot on these things. So thank you very much.